Hello and good evening. Welcome to the curious reappearance of sterile instruments looking behind the scenes. My name is Dr. Marie Fluent, and I would like to introduce this course. The course is about instrument processing and what happens behind the scenes. And well, the story behind my red curtains and the curious reappearance is this. As your instruments lie ready and waiting to be utilized for safe patient care, one might scratch one's head. How did they get there? This webinar will review behind-the-scenes journey that dental instruments take on a daily basis called the instrument processing pathway. Along this complex and cyclical journey, standards, best practices, and methods of sterility assurance will be addressed. With attention to detail, dental personnel may maximize infection prevention goals and assure safe work environment for those involved in sterilization and disinfection tasks. Now, bear with me, there we go. I'm learning how to work this program. The credits belong to Air Techniques for sponsorship of this program. Without them, this would not be possible, so thank you very much to Air Techniques. The plot, we're going to call this the course description. The dental procedure is complete. Your patient has been dismissed from the operatory. Contaminated instruments remain in its state of disarray on the bracket table. Yet, as your next patient is seated, wrapped in sterile instruments and packages curiously seem to reemerge ready for safe patient care. How did they get there? We're going to look behind the scenes. Our learning objectives, we're going to review Spaulding's classification to determine which patient care items must be heat sterilized. We're going to talk about the steps involved in instrument processing. We're going to describe the methods for cleaning, packaging, and sterilizing instruments. We're going to identify methods to assure sterility, including mechanical, chemical, and biological monitoring. And before we begin this program, I'd like to let you know that this is a live webinar, and at the end of the presentation today, I will take questions and answers and provide answers to the best that I can, and you will be guided to a quiz, a 5-question quiz. If you are indeed paying attention, it should not be a difficult quiz at all. I'd like to also make a note that we have about 300 people who are participating in this presentation. Not quite standing room only, but more will hop on, I'm sure, as time goes on. So thank you for spending the next hour with me. I noticed from the attendee list that we have most folks from the United States and various states around the country, but we also have some Canadian colleagues and colleagues from other countries as well, Middle East, European countries, etc. So welcome to all. I appreciate you being here with us. So the director, and keep in mind that to keep this fun, I have attached theater and theatrical terms to all of my slides, so to the best that I can, just to make this fun. So the CDC, or the Centers for Disease Control and Prevention, is this document written by the CDC continues to be the blueprint document for infection control standards in the United States. The CDC is an advisory agency, thus the information in this document comes out as recommendations. But keep in mind, many states have taken these recommendations and turned them into law, so keep in mind the local and state dental boards in your area and see how they mention the CDC guidelines, because this may be regulatory in your specific area, so keep in mind of that. Now, the newest lyrics, the CDC came out with a new document in 2016. The previous document was written in 2003. In 2016, the CDC evaluated the CDC guidelines and said, are they adequate? Are they really helping keep our patients and our personnel safe? And the answer was yes, they are indeed adequate. They are doing the trick. However, we need better compliance. As a result of that, CDC published published this most recent document, Summary of Infection Prevention Practices in Dental Settings, Basic Expectations for Safe Care. The document is based on the 2003 guidelines. It represents basic information, and it is written in plain language, i.e. there's not a lot of scientific jargon, and it is not difficult to read at all. Keep in mind this is not a replacement for the full guidelines. There are some new guidelines since the 2003 publication of the initial guidelines. And as I go through my presentation, when these new guidelines arise, I will highlight them and point to them so that you are aware this is new information since 2003. Keep in mind that the CDC summary represents basic infection prevention expectations. It's not lengthy, it's not complex, and it is not an entirely new set of infection prevention recommendations. I like to equivocate this document to Cliff's Notes. Way back in high school when we were studying literature, Cliff's Notes or Sparks Notes for younger learners were an abridged edition meant to supplement the original body of work. That's how I view this summary. It's not meant as a replacement of the CDC guidelines written in 2003, but meant as a supplement. It can be used as a study aid to facilitate learning rapidly learning key points, provide a fresh point of view, encourage the reader to take an active role in their education, and it may serve as an introduction, a refresher, or a quick and handy reference on the topic of interest. So in this document, there are blue boxes that share the basic expectations for care, and of course you can always go up and beyond those, but these are the minimum expectations. So I will point out areas within the CDC summary that share this information. But before we go on, I want to talk about Spaulding's classification. The original Spaulding's classification was written way back in 1957 and was written as a system for sterilization and disinfection of surfaces, particularly reusable medical or surgical devices. This has since been adapted for dentistry, and this chart is in the CDC guidelines 2003. Note that there are three main categories: critical instruments, semi-critical, and non-critical instruments. Critical instruments are those that penetrate soft tissue, contact bone, or contact the bloodstream or other normally sterile tissues. And some examples would include surgical instruments, dental burrs, periodontal scalers, or scalpel blades. Note on the left that these critical instruments absolutely must be heat sterilized, or the alternative, of course, is to use a single-use disposable instruments. For instance, most practitioners use disposable scalpel blades and just throw them away in the sharps container when you are done with a single use. Semi-critical instruments are those that contact mucous membranes or non-intact skin, but they don't penetrate soft tissue, they do not contact bone or enter into the bloodstream at all. These instruments, some examples may include dental mouth mirrors, amalgam condensers, reusable impression trays, and hand pieces. Non-critical instruments require disinfection only. These instruments contact intact skin, and they may include radiograph heads, cones, blood pressure cuff, face bow, pulse oximeter, etc. And these require disinfection only, so no confusion there. The only area of confusion on this chart where I see is the semi-critical category. Back in 1957, there is no way that Spaulding could have anticipated the high-tech devices that are used today. For instance, our digital radiograph sensors, or digital impression wands, or all of the other high-tech devices that are used today. These items ideally should be heat sterilized, but let's face it, we're not going to put a digital radiograph sensor in the autoclave. So let's talk about that for a second. So let's start off with hand pieces. High-speed hand pieces And I'm going to read this slide. Normally I do not like to read this slide, but there seems to be lots of confusion around dental handpieces as of late. So dental handpieces and associated attachments, including low-speed motors and reusable prophy angles, should always be heat sterilized between patients and not high-level or surface disinfected. Although these devices are considered semi-critical, studies have shown that their internal surfaces can become contaminated with patient materials during use. If these devices are not properly cleaned and heat sterilized, the next patient may be exposed to potentially infectious materials. Now, CDC wrote this in the CDC summary, and it caused lots of controversy, but what I want to share with you is that this is not a new recommendation since the 2003 guidelines. As a result, the American Dental Association came out with a statement on its website in March 2000 of this year, saying that the ADA and CDC are working together to clarify handpiece infection control recommendations. So if you have any questions or concerns at all, consult the CDC guidelines or the ADA website, and the statement that is in front of you is consistent with both agencies' stance on handpieces. Now let's go back to the other high-tech devices, and high-tech devices such as digital radiography sensors, they're considered semi-critical and should be protected with an FDA-cleared barrier to reduce contaminated during use, following by cleaning and heat sterilization or high-level disinfection between patients. So if the patient can't, if the item can't tolerate these procedures, then at a minimum, protect with an FDA cleared barrier, and in addition clean and disinfectant with a EPA registered hospital disinfectant with TB claim between patients. So with high-tech devices, until our instrument processing catches up with technology, this is the best we've got to offer. And I encourage all of you to refer to the manufacturer's instructions for reprocessing, because specific instructions should be provided for you. And at a minimum, use a barrier, an FDA cleared barrier, and clean and disinfect between use. Now let's look at your individual dental device, and can it be reprocessed? Know that the manufacturer's instructions for cleaning and disinfection instructions should tell you exactly how the instrument or device should be processed. If the manufacturer doesn't provide such instructions, then the device may not be suitable for multi-use and perhaps be thrown away in between after patient use. Some instruments that fall into this category, burrs and possibly endophiles. Some are considered single-use, some are considered multi-use. Some countries mandate that these are single-use only. So check with your manufacturer's instructions and know the regulatory guidelines in your area where you are practicing. Now, one more thing I want to stress on this slide is to have the manufacturer's instructions for reprocessing reusable instruments and equipment readily available, ideally or near the reprocessing area. And note that this is a new recommendation since the 2003 guidelines. That is, have those instructions for use available. What I like to do, or I'm no longer practicing dentistry, but what I liked to do when I was practicing is have the instructions posted in my reprocessing area on the inside of the cabinet, have pertinent areas highlighted for quick reference, and refer back to them periodically. So now this is a CDC recommendation, and we should be aware that instructions for use have are definitely a part of our instrument reprocessing protocol. Now we are on to rehearsals. And I'm calling this rehearsals, but I'm actually referring to appropriate training. Appropriate training should be provided to dental personnel upon hire annually, and when new tasks or procedures affect the employee's occupational exposure and according to state and federal requirements. So in other words, if you have somebody at the front desk and all of a sudden we need her in the back to help process instruments because we're getting backed up in the reprocessing area, boy, that employee needs to go through training to make sure she knows what she's doing and to make sure that she is safe. Say you purchased a new autoclave or you have new chemicals that are used for processing instruments. Once again, new training is indeed required. And of course, training records, maintain those records in accordance to state and federal requirements. Now let's talk about costumes. Costumes, actually personal protective equipment, need to be worn when handling and reprocessing contaminated patient equipment. The PPE protects skin and personal clothing, and it may include masks, eyewear, protective clothing, and puncture-resistant heavy-duty utility gloves when transporting, cleaning, and contaminating instruments. And reusable gloves should be cleaned and disinfected daily or sterilized or discarded when effectiveness is compromised. And by that we're meaning the heavy-duty utility gloves that are a little bit more chemical resistant and puncture resistant than examination gloves. Anytime you are handling contaminated instruments, it is recommended that these are worn as they are much more protective. Now keep in mind they don't last forever, and if they become compromised, you see cracks, perforations, etc., throw them away, get a new pair. Some of these can be heat autoclaved. Look on your instructions for use and monitor that and wear them whenever you are handling contaminated instruments. Now here we are. This is the theater, the instrument processing pathway. This instrument processing pathway is a cyclical cycle that dental instruments take on a daily basis. Instrument processing requires multiple steps, including specialized equipment, adequate space, qualified personnel who are provided ongoing training, and regular monitoring for quality assurance. And this information comes right from the CDC guidelines. Now we are on Act 1, the transport of contaminated instruments. In front of you, you see CDC versus OSHA, and I want to read two statements for you on what CDC and OSHA says about the transport of contaminated instruments. The first statement, instruments should be placed in an appropriate container at the point of use to prevent percutaneous injuries during transport to the instrument processing area. That comes from CDC guidelines. OSHA says, from the Bloodborne Pathogen Standard, contaminated sharp instruments be transported in an appropriate container that is puncture resistant, labeled or color-coded, leak-proof on sides and bottoms. So we have a little bit of a discrepancy between CDC guidelines and OSHA regulations. So note the wording and note the discrepancy. So what do? Let's look at this slide. Which would be a proper method or a safe method for instrument transport? The first image on the left is an open tray, and you can see there are sharp instruments coming and going. You can see that if this dental personnel turned the corner, they would be at risk of bumping into somebody and having sharp instruments fly every which way. That is exactly what we don't want to happen. This should be an appropriate container, as CDC mentions, and OSHA says let's cover the sides and bottoms so it is also leak-proof, and that is what is shown on the image on the right-hand side. So once again, I recommend that you look at the regulations in your area and make sure that you are indeed in compliance, and if in doubt at all, provide a leak-proof covered container as you see on the right-hand side. Now we go to the stage, and that is our instrument processing area. This slide shows what's meant to be in an ideal instrument processing area for dentistry. The photo is an example of a modern dental sterilization center where the directional flow is built into the design. So on the left-hand side, you can see this is the receiving area where contaminated instruments arrive, and as you exit to the stage right, you will see the sterile section. And each section along the way has a partition, a dividing wall, to prevent splashes from a more contaminated to a clean and finely sterilized area. Some features of modern sterilization centers may include red and blue lights to indicate the dirty or the clean side. There may be covered storage areas for both contaminated and sterile storage that are activated by foot controls. The ultrasonic cleaner, as you can see in this image, is recessed right into the countertop, and the particular design has a built-in drying drawer where instruments and cassettes can be placed for easy drying. And later on in my presentation, we will talk about the importance of dry instruments going into the autoclave and why that might be beneficial. So this is the instrument processing area. You can see it is divided up into sections, and the sections include on the left-hand side, receiving, decontamination, and cleaning. The purple area toward the right is for packaging, and then we move on to the sterilization area where this office has 2 autoclaves, and finally on the right-hand side we have an area for storage. But let's look further into this image and see what is going on behind the scenes. This is my first outtake. Let's look at what might be wrong with this picture. And there are a couple of things. Number 1, there is a household dishwasher. I do not know why. A household dishwasher is not an FDA cleared device for instrument processing and should never be used for instrument processing. An instrument washer, if you want to use that for your instruments, is a much better choice, and we'll talk about that in a minute. Number 2, I said this area is meant for instrument packaging, but look, there's a handpiece maintenance system in this location, and it takes up the counter space that's meant for instrument wrapping. You'll notice the drawers right in this section right below are very narrow and long, and they provide packaging materials, wraps for cassettes and various sizes of pouches, etc. And there should be a nice open clean countertop to make that happen. But the handpiece maintenance system sits right in the way. So in an ideal sterilization center, this would be moved over to the left. And finally, you can't see it in this image, but there is a sharps disposal on the left-hand side built into the countertop. And we'll talk about sharps disposal in a second, but the sharps disposal should be located at the point of use. We should not be transporting sharps around the office. They should be used at chair side and put immediately into the sharps container box. So this is a wrong location for that. So it is a beautiful sterilization center, but there are a number of things wrong. But I would like to point out that that is, have you looked at your sterilization center with a critical eye? Are there any areas that are not, that could be improved upon, any areas that would impede compliance? So look at your own sterilization center with a critical eye. And like I did in this particular dental office, the dentist owner put in a beautiful, gorgeous sterilization center, but there's room for improvement. So now let's talk about some props. And one prop that I want to mention is cassettes. There are numerous benefits for using cassettes for instrument processing, including safe transport because all of the instruments and sharp tips are contained within, safe instrument cleaning because you're not handling the instrument tips, ease of instrument setup. When you open up that cassette, all instruments are at your fingertips ready to go, ideally in the proper order. Finally, you cannot overload the sterilizer. If you look at the image on the lower right-hand side of a sterilization chamber, you can see that only 3 cassettes fit in there, and you cannot overload any more in there. It is physically impossible. Storage is easier as well. Look at the image on the left. You can see a shelf for each cassette on a shelf. They're easily identifiable, easily retrievable. So the storage is easier as well. And then look at the final image of my mouth mirror on the right-hand side. This instrument instrument was processed loose in an ultrasonic numerous times, and you can see the scratch and abrasion marks of other instruments rubbing against it in the ultrasonic cleaner. If you utilize cassettes, those mouth mirrors will be safe within the cassette, and no instruments can rub back and forth on them, and it will preserve your instruments in the long run. Now let's go to Act 2, the receiving area. We talked a little bit about that when we looked at the instrument processing area, and we did mention that the sharps container should be at the point of use. Single-use items, do not reprocess them. Some items are meant to be used once and only once. Look for the symbol on those items and know if they do not have instructions for reuse that they may not be reusable and you must dispose of after a single use. Reprocess instruments ideally immediately after use, and if you cannot, place instruments in a holding solution, and this number one removes the bulk of the microorganisms during cleaning, and number two, it loosens up the debris so it doesn't adhere or affix to the instruments. And as we'll discuss further on in our presentation, items must be cleaned before they are sterilized. So the receiving area is meant to enhance all of the above and meant to sort the instrument trays and get the cleaning process going. There is an optional step called pre-cleaning. Say you work in a high volume practice and you cannot get to your instruments right away, this step might be for you. This step includes immersing instruments in a detergent or an enzymatic cleaner or a disinfectant, or spraying with an enzymatic solution. And once again, that loosens up the debris and prevents it from adhering to the instrument, and it makes cleaning easier when you can get to that task. So many practitioners or clinicians will pre-clean their instruments, spray them with an enzymatic cleaner, go turn over their operatory, and then come back and reprocess the instruments. But keep in mind, this is an optional step, but it may make your life easier in the long run. Now, instrument cleaning is important because cleaning is essential prior to disinfection and sterilization. If you have organic debris on your instrument, and you can see in this image there's organic debris, the instrument surface, it can trap in infectious microorganisms. We cannot guarantee the sterility of this instrument if it goes through the autoclave. We do not know if the sterilant can penetrate the debris on the instruments and kill those microorganisms or not. Thus, all instruments must be properly cleaned, rinsed, and dried prior to sterilization. The step is essential as organic debris will compromise the disinfection and sterilization process. There are several methods of instrument cleaning: hand scrubbing, the ultrasonic, and a washer disinfector. Hand scrubbing is the least effective, and it poses the greatest risk to those who process instruments, and that is because your hands are near sharp tips and under running water, and you can see that this could pose some risk of a percutaneous injury. So if you must hand scrub your instruments, do it under running water, a long-handled brush to keep your fingertips away, heavy-duty utility gloves that are a little bit more puncture resistant and chemical resistant, and of course wear appropriate PPE. Going down to ultrasonic units, most dental facilities use these. We'll elaborate on ultrasonics in the next couple of slides. And finally, washers or instrument washers or disinfectors. Know that this is not a household dishwasher. A washer or disinfector is the most effective and poses the least risk of all of the methods of instrument cleaning. And know that any device that you use to process instruments must be FDA cleared for that purpose. As I mentioned earlier, a household dishwasher is not. So let's talk a little bit more about the ultrasonic cleaner. Here's some do's and don'ts. when you use an ultrasonic cleaner, do use the metal basket for inserting and removing the instruments. Do keep the lid on during use. Do use the correct solutions, and not only the correct type of solution, but also keep in mind the correct amount of solutions. Some of these ultrasonic tanks are 1 gallon, some are 2, some are 3. And some of the products used as solutions are pre-packaged in unit dose for 1 gallon, 2 gallon, or 3 gallon tanks. So obviously if you are using a 1 gallon unit dose product and you have a 3 gallon tank, you need to triple on up. So use the correct quantity of solution as well. Change that solution daily or more often if needed. And I equivocate this to cleaning up after a big holiday dinner with my family. If I'm doing dishes and I've got load after load of dishes to do and lots of leftovers that might be floating around, I change the solution of my dishwasher washing pan quite frequently, not over and over again until it's pretty cruddy with food floating in there. At that point, it's probably not so effective. So if you see it's contaminated, you see debris floating in there, go ahead and change the solution more frequently. And this may be more appropriate in high volume practices or perhaps surgical settings where you have more debris on instruments. Do follow the manufacturer's instructions and do make sure that all instruments are indeed submerged. Don't ever reach your hand into an ultrasonic and do not overload. If you overload, we cannot guarantee that the sound waves will bomb blast all surfaces of the instrument, and if you reach your hand into the ultrasonic, you can't see the sharp tips that may be within. Keep your hands out of the ultrasonic. Use that basket to insert and remove instruments each and every time. Now there are different types of cleaning solutions, general cleaning solutions and enzymatic cleaners. And there are advantages to the enzymatic cleaners. These contain enzymes that will break up the bioburden and debris more rapidly than the non-enzymatic, and they're shown to reduce the need, if any, for hand scrubbing. Some solutions such as these can be used for pre-cleaning solutions, holding solutions, and of course there are spray forms as well. Now, how do you know that your ultrasonic is indeed working? And the answer is you may not know unless you test it. There are different ways of validating, that is, ensuring that your instrument or your device is working properly. Historically, people used what was called the foil test. In this method, a piece of household foil, approximately the length of the chamber of the ultrasonic, would be inserted into the ultrasonic, and the ultrasonic unit turned on for about a minute, minute and a half. And when that foil is removed, you should see uniform pitting and sometimes perforations throughout. And an example of this is in the piece of foil that's displayed in the lower portion of this image. Now there are other commercial testing kits that are available. There's a dosimeter on the upper right-hand side that can be inserted, and as it goes through the ultrasonic, it changes color. And then there are instrument wash checks that are shown on the right-hand side of the screen. And these are little test strips that are placed into a device and put into your ultrasonic. The ultrasonic or the instrument washer is turned on, and the cavitation time and temperature, detergent amount, and number of instruments will affect the outcome of this test. So it's recommended that you put it in an empty chamber and run it for per the manufacturer's instructions, and that little spot of ink on the right hand side should be all washed away. If it's all washed away, great, your ultrasonic is functioning just fine, and if not, you may have an issue with your ultrasonic or your instrument washer, and it should be investigated at that point. Note that some of these devices on the right hand side are meant, some are specifically meant for an instrument washer, others are meant specifically to test an ultrasonic. So make sure that you follow your manufacturer's instructions to a T. I see a couple of questions that are already coming in, and one question says, should the ultrasonic not be overloaded? The answer is if it is overloaded and you have too many instruments in it, number one, the instruments may not be submerged. The only way the sound waves can hit them is if they are below the water level. And even below the water level, if they are overloaded, the sound waves cannot hit each and every surface if there are too many instruments in there. They need to be loose in there, either in the cassette or loose, but not overloaded. And here's another question. This one involves an instrument packaging, so hold that thought. We'll come back to you. Okay, let's talk a little bit more about dental handpieces. And as I mentioned earlier, handpieces absolutely must be cleaned and sterilized between use. To properly clean a handpiece, it should be flushed with the air water line for 20 to 30 seconds with the burr in place, cleaned and dried, removing the burr, lubricated. The excess lubricant should be expelled. The fiber optics, if you have them, should be cleaned, and then they should be packaged and heat sterilized. The image on the lower right-hand side came from a friend and colleague of mine, Karen Daw, who's an infection control consultant, and she took this image from an office where they were using an environmental surface disinfectant instead of autoclaving their handpiece. And look at how the surface is pitted and stained, and there's a little bit of rust on that. That's not good, and I'm sure that would avoid the manufacturer's warranty as well. So it's important that you follow the manufacturer's instructions for cleaning and lubricating and packaging your high-speed handpieces. And as we already discussed, it's not an option. Now, to do this, many offices are using an automated handpiece maintenance system. They provide consistency and efficiency, and they may extend the handpiece warranty. Some handpiece manufacturers extend the warranty if you use the handpiece maintenance system. Always consult the manufacturer's instructions for proper maintenance instructions. Before these existed, I remember cleaning and lubricating our handpieces by hand and putting the lubricant into the handpiece manually. And unfortunately, it kind of gummed up in there, and we had a drawer, I called it the handpiece graveyard, and that was a specific drawer for handpieces that had frozen turbines and chucks that needed to be sent in for repair. If you use a handpiece maintenance system, that shouldn't be necessary, because once again it provides consistency and provides lubrication and blasts out the excess lubricant consistently and effectively each and every time. So if you don't have one of these, I encourage you to look into one. So after instrument cleaning, rinse the residual debris or chemicals from the cleaning process, and then instruments should be dry. Drying helps to ensure that the instruments will emerge from the sterilizer dry, and instruments should come from the autoclave dry. And then, of course, instruments need to be inspected. We're inspecting for any type of remaining debris. We're inspecting for fractured instruments, etc. So look at your instruments and make sure that they look clean, make sure that they're intact and functioning properly. Now we are on Act 4, preparation and packaging of instruments. Follow the manufacturer's instructions, open and unlock hinged instruments, disassemble if required, place an internal chemical indicator inside each package, place an external indicator if the internal indicator cannot be seen, label the sterilized items with the sterilizer used, the cycle or load number, the date of sterilization, and if applicable, the expiration date. And this all comes from the CDC summary, Basic Expectations for Care. Note that the highlighted area of labeling the sterilized items is a new recommendation since the 2003 CDC guidelines. Now, sterilization wraps can include pouches or wraps, and pouches are ideal for loose instruments, small items. As mentioned, there should be an external indicator if the internal indicator is not visible from the outside. There should be adequate space within the pouch, and don't overload the pouch. And this was a question that came up from one of my attendees, that we should not overload the instrument pouches. The reason for that is, once again, we need the sterilant to penetrate the pouch and be able to touch every surface of the instrument within. If the pouch is overloaded, that may not be possible, and we could not guarantee sterility. So do not overload your pouch. Wraps are ideal for cassettes. Don't write on the blue material. And make sure that there are no open gaps within the pouch. It should be wrapped tight like a gift. So here's another outtake. What do you think about this? Is this an effective packaging material? This particular office was cutting the sterilization pouches in half, I think to save $1, and they placed a chemical indicator inside and used external indicating tape to close it up. Well, this is not following manufacturer's instructions for the use of the product, and this is not a good idea. A little bit about immediate use sterilization. Instruments may be sterilized unwrapped, but only in emergency situations, not routinely. Instruments that are used for implantable devices should not be sterilized unwrapped, and consider sterilization a process, not an event. So in other words, this is only an emergency situation. If you use unwrapped sterilization cycles, make sure that you have a chemical indicator within the cycle. Dry and cool in the sterilizer before handling. Handle aseptically during removal. Use the instruments as soon as possible, and never store instruments unwrapped, and do not sterilize implantable devices unwrapped. Now we are on to sterilization itself. Use FDA-cleared devices and follow the manufacturer's instructions. You may use chemical vapor and a chemclave, dry heat, steam sterilization, but know that steam sterilization is the preferred method of decontamination for critical and semi-critical equipment and devices. Chemical vapor and dry heat are rarely used anymore. There's a little bit of history on why dry heat was used in orthodontic practices, but know that the new ortho instrumentation is compatible with steam sterilization, so most dental practitioners use steam sterilization at this point. Chemical sterilant or high-level disinfection should be used only for heat-sensitive critical and semi-critical devices, and the use of glutaraldehyde is discouraged. It's very, very toxic, and it makes debris adhere to the instruments more than other cleaning solutions. And there are many disposable alternatives that are available, and heat-tolerant alternatives that are available. So know that heat sterilization is indeed the gold standard. When you load the autoclave, never overload the autoclave. Ideally, instruments should be placed on edge in a rack that's shown on the left-hand side of the slide. And if you use cassettes, this is a great image in the center that shows that there are shelves to support the cassettes so that the sterilant can reach all surfaces, and the image on the right shows that this sterilizer is overloaded. Possibly somebody needed to get out of the office earlier on a Friday night. If you don't have a rack such as this on the left-hand side, ideally paper side up, plastic side up, paper side down. And if you are unsure of that, read your manufacturer's instructions to make sure that you are loading the sterilizer correctly. Here are some sterilizers do's and don'ts. Do clean and sterilize all known disposable intraoral reusable items. Do not sterilize or reuse disposable items. Do wrap or pouch all items to be sterilized. Do not handle wet packaging. If you have a wet instrument package that comes out of the autoclave, you should not be handling it. The moisture acts and the packaging acts as a wick and absorbs any type of microorganisms that might be on your hand and that will compromise the sterility. We mentioned overloading, not a good idea, and do ensure routine maintenance for sterilization equipment is performed according to manufacturer's instructions and maintenance records are kept. And I want to point out that this is highlighted and is a new recommendation since the publication of the 2003 guidelines. So in other words, routine maintenance and keep this information on file. Sterilization monitoring. There are three main ways to monitor sterilization: mechanical, chemical, and biological. Mechanical and chemical do not guarantee that sterility has occurred. They measure the parameters for sterilization and ensure that those parameters have been met. The only way to really guarantee that sterilization has occurred is by biological monitoring or spore tests. So let's look into each of these. Mechanical monitoring is the observation of the mechanical readings. Some autoclaves can print or send cycle parameters electronically. They will provide early indication of a cycle failure, and each load should be monitored with mechanical or physical indicators. Chemical monitors show the parameters for sterilization have been met. They respond to a change in any process variables such as time, temperature, pressure, etc. Know that there are 6 classes of chemical indicators, but for the purpose of our presentation today, we will not get into details about that. A chemical indicator should be placed inside each package. If the internal indicator is not visible, use an external indicator as well. Biological monitoring. The CDC recommends weekly biological monitoring, but be careful. Those of my colleagues who are listening, and especially in Canada, know that you have different recommendations based on your provincial guidelines, and different countries may have different regulatory regulations with regard to monitoring as well. So know that the CDC recommends weekly, but know that your regulatory agencies may have other guidelines for you as well. And know that biological monitoring should occur if there are any changes made to your sterilization procedure, i.e. you've purchased a new autoclave, i.e. you have more personnel, new personnel who are sterilizing instruments. If you have a positive spore test, remove the sterilizer from service, and the CDC guidelines has much more information on what to do in case of a positive spore test. Briefly, if you have a positive spore test, remove the sterilizer from service, review your sterilization procedures, retest using mechanical, chemical, and biological indicators. If it's negative, you can put it back in service, but if you have a positive spore test again, stop. Do not use this autoclave. Take it out of service. I would recommend consulting with CDC guidelines for more information and contact the representative of your unit for a loaner and obtain a different sterilizer until you get this straightened out. Okay, we're going to call this the playbill. This is the sterilization, monitoring, and maintenance records. And I want to mention that you should have a logbook that contains the physical parameters, time, temperature, pressure, and readings, the chemical indicator monitoring results, the sterilizer load number, the date of sterilization. If you have a USB recording or printout, incorporate that information as well, or the physical parameters, you can write it down if you do not have a printout, the load contents, and then of course the person responsible for the sterilization. And this should be, this logbook should be kept intact so you could retrieve instruments and trace back the instruments and know better guide you to what went wrong and how to correct the scenario. Finally, instruments must be kept sterile until use. In Act 7, the storage. They should be stored in an area that is clean and dry, ideally covered in a closed cabinet. If the packages are compromised, this means wet, torn, or punctured, they should be reprocessed. Open instruments at the point of use. I had a dental assistant who was quite zealous and enthusiastic, and one day I saw her setting up for a crown prep the night before the procedure that was to occur at 8 o'clock the next morning. Well, her instrument package was open, all instruments were out, the handpiece was set up, everything was ready to go, and she was out the door because she knew she would be rushed the next morning. Well, I said, well, that's great and all, but those instruments won't be considered sterile. We need to repackage them, reprocess them, and open them right before use in the morning. And then use date or event-related storage. Most offices use event-related storage, which means that the instrument remains sterile unless some event compromises the package, i.e. wet, torn, or punctured. So instruments packages should be labeled, and we should be able to retrieve them if needed in case of an instrument recall. Now here are some examples of proper storage. The instruments are all packaged up, neatly organized in drawers or on shelves. Some of them you can see the contents within, some of them are labeled, but these are all great examples of proper storage. And you can see the ones on the left are in a drawer, and in the center they are within a closed cabinet. Now here is an outtake. Improper storage. You can see on the left-hand side, this is a drawer of unwrapped instruments. We have no idea when and if these instruments were sterilized, nor do we have any idea who placed their contaminated gloved hand within this drawer. These instruments are not safe for patient care, and we should not have drawers like this in our offices. On the right-hand side, we see a pile of hand pieces that are unwrapped, ready to go for patient use. And once again, we do not know if these instruments have been sterilized, not sterilized, or whose contaminated hands have touched them, and they are not considered safe for patient care. So no unwrapped instruments ready for use. Instrument packages should be inspected. We should be looking for the results of the internal and external indicators, any discoloration of the package, defective equipment, signs of dampness or wetness, and if we see any of the above, the instruments should be reprocessed from the beginning. So our take-home points, and we'll call this our encore, that we should ensure dental personnel training. Policies and procedures and manufacturers' reprocessing instructions should be readily available. Use only FDA-cleared medical devices for sterilization. Instrument processing workflow patterns in the instrument processing area should go from contaminated to sterile with a one-way flow of traffic. Weekly spore tests are recommended for each sterilizer. Store sterile instruments in a dry, closed, covered cabinet or drawer, and review and document the daily operation of every sterilizer. So let's see some questions. Oh, by the way, let me go to my final slide. I have some resources for you, the CDC guidelines and the CDC summary. Note that these can be downloaded for free from the CDC website, and if you have a reprocessing failure, the CDC has more information on its website on what to do next. So bravo and thank you, and I do want to address some questions at this time. So let's see. Here's a question that says, when instrument packages come out of the steam sterilizer, oftentimes they are wet. Is this a sign of a problem? This question comes from Lori, and yes, it is a problem. Number one, you should not be handling wet instrument packs, and if you do have wet instrument packs, you need to troubleshoot. First of all, ensure that your instruments go into the autoclave dry, and that you will have a greater probability that they will emerge from the autoclave dry. Also note that there are two types of autoclaves, steam and a gravity autoclave. A pre-vacuum and a gravity autoclave. A pre-vacuum helps to ensure a dry instrument pouch as a vacuum pulls all of the steam and moisture out of the chamber and lets in the dry air at the end of the cycle. So if you continue to have a problem, consider purchasing a pre-vacuum autoclave, and I can urge you to consult with your manufacturer's instructions and troubleshoot to see what the problem might be. Here's a question that says, we are a general office, but we do quite a bit of orthodontics. What is the best way to sterilize our cutters without dulling them? And historically, orthodontic instruments, as I mentioned, would be autoclaved in a dry autoclave, but the newer instruments and the nicer and newer high-tech instruments can withstand steam sterilization without dulling them. So look at the instrument that you are using and make sure that it is compatible with steam autoclaving, and if not, I encourage you to investigate some different instruments. Okay, here's a question. I don't know if I can answer this specifically. The doctor will not autoclave his implant drivers to tighten or untighten. He's uncomfortable with this. Only wipes down with a Cava wipe, and you are correct. They really should be autoclaved. So, and the question is will the autoclave process damage these instruments? Not sure. I encourage you to go to the implant company and look at the reprocessing instructions and see what they say. I will bet that they do recommend autoclaving, and these instruments should be heat autoclaved in between use. Okay. Here's a question. We are using a tie wrap for the instruments in an autoclave. Isn't it better to just lay these loose in the ultrasonic for better cleaning? We do not have cassettes. Instrument ties, first of all, look at when these were manufactured and what type of device you are using. Anything that you are using for instrument processing must be FDA cleared for that purpose. So if the manufacturer's instructions indicate that it is safe and you can safely and efficiently clean and effectively clean using this instrument tie, then so be it. You can go ahead and use it, but if no such instructions or validation exists, then you should not be using that instrument or wrapping tie. So look at the device and make sure that, for instance, you cannot use a household rubber band to hold your instruments together in an ultrasonic. You can't do that. So ensure that the device, whatever you are using, is FDA cleared for that purpose. Here's a question. Where are some examples of logbooks found? You can find them in your instrument supply catalog, and if you don't see them there, contact the manufacturer of your autoclave and they can either provide one for you or lead you off in the right direction. Let's see. Thank you for the presentation. Oh, you are most welcome. Thank you for the kind words. I'm still flipping through the questions, so bear with me. And here's a question. In transporting, would a closed cassette need to be in another container? According to OSHA bloodborne pathogen standard, yes, because a closed cassette is not leak-proof. So ideally, yes. Here's a question from Diane. Handpieces and ultrasonic scalar inserts cannot go into the instrument washer. Is wiping with wet gauze an option for cleaning? If hand pieces cannot go into the instrument washer, so consult with the manufacturer of these devices and see what they recommend for cleaning and follow those instructions. Typically they involve wiping the outer surface to remove the debris, putting in a handpiece maintenance system, wiping off the fiber optics and making sure the instrument is dry, packaging them, and autoclave them. So consult with the manufacturer of each of these devices for specific recommendation. Here's another question. Why is it not okay to write on the wraps? Well, we do not want to add any type of chemicals into the wrapping material, and as mentioned, the wrapping material can act as a wick and absorb anything that is used on it. So write on the plastic side of a pouch, and if you are using cassettes, write on the packaging tape. Here's a question from Charlene. Is an internal indicator used with cassettes as well? Absolutely. They make separate internal indicators that come in little strips, if you will, and put one little strip inside each cassette and close it on in there. And when you open up that cassette and it's ready for use, look to make sure it has indeed changed color. Here's a question by Edward. I was previously told that sterilization packs should be loaded paper side up so that the steam can escape and the inside can dry out when done. Is this incorrect? Edward, the newer autoclaves say paper side down, plastic side up, because the ventilation is through the bottom of the chamber, and if you use a pre-vacuum autoclave, the vacuum is at the bottom of the chamber and the paper is more can be penetrated more than the plastic. Having said that, Edward, some of the older autoclaves do say the opposite. So I encourage, without knowing more pieces of the puzzle, what type of autoclave that you use, I would urge you to consult the manufacturer's instructions to make sure that that is indeed correct for your autoclave. But the newer autoclaves are plastic up, paper down. So with that, it is 8 o'clock Eastern Standard Time, and I am going to close my presentation at this time. When I close the presentation, you will be guided to the 5-question quiz, and I do believe that the quiz should be very easy for all of you. I addressed all of the points during my presentation tonight, and I thank you for spending this evening with me and following along in the curious instrument processing pathway, what's happening behind the scenes. Thank you so much and have a good evening.